Let us turn our attention to healthcare. In terms of healthcare, developing nations continue to concentrate on decreasing infant mortality and on preventing common infectious diseases. What does this mean for Pakistan? We are a developing nation, and our job is to try and decrease the infant birth death rates. When young people are born and they die in the first year of their life, it is affecting the nation. So the task of developing countries is, how do we decrease this? Two things need to be considered. We need to look at prenatal care, and we need to look at postnatal care. We need to provide the facilities, the health clinics, the health centers, the hospitals, where individuals can go to receive this kind of proper health care. In the big cities, it is possible, but again, as I said earlier, it comes with a price tag. And if you can't afford it, you will not be able to go and get that kind of prenatal health care and postnatal health care. In villages, it is even worse, because even the rural health centers are normally not equipped with the tools, with the equipment, with the medications that might be needed to avoid some of these early deaths in the first year or the first 3 years of life. That's the most crucial time, because these infants born are vulnerable. They are vulnerable to infections, to diseases, to common cold. And in the rural areas especially, how does one let the individuals know? In other words, the parents know what to do, how to do. Common practice is, the previous generation did this, so it worked, let it continue. That's not going to hold true anymore. In the 21st century, healthcare should reach all individuals, and it should be within the means of all individuals. Many people will argue that there are government hospitals, but they are so ill-equipped. Where are the facilities? If you ever go and visit the government hospitals, the state of those hospitals are absolutely pathetic. Cleanliness, that's the key to good hygiene. That's the key to good health. Sanitation is key. Where do we see all this? How do we see it? We don't even see good hygiene and sanitation in many rural homes, and even in the slum areas of the so-called modern cities, this exists. As long as we have overflowing gutters and clogged drains and rainwater collecting and not siphoning off, this exposure will be there, and it's not good for anyone. So that's one aspect. How do we decrease death rates in the early years after a child is born? The second is, how do we prevent common infectious diseases? Infectious diseases are diseases that can be transmitted from one individual to another through contact. And so, if you have an infectious disease, how do you avoid coming in contact? For example, chickenpox or measles, they are contagious. They spread through contact. Unlike malaria, that doesn't spread through contact, it spreads through a mosquito. That's a different way of dealing with how do we control mosquitoes from coming into our homes and enjoying a nice meal on us. So, unless we can focus on the differing aspects required for looking at increasing healthcare facilities to our population, rural and urban, at affordable rates, is absolutely critical. Industrialized nations, having rid themselves of the more common contagious diseases, struggle in a different way. They don't have to deal with contagious diseases. They've dealt with that, vaccinations, immunizations, and all that, and but what they're dealing with now, or have to deal with now, are unprecedented man-made threats to health. As more industries and factories operate, pollution such as air, water, and noise, and stress of modern urban living, transportation, getting to work on time, the rush, the traffic jam, how early do you go, how late can you leave, and all that. That causes different types of health concerns in the developed world. So, as I said earlier, nations have to deal with their own situation, their own factors that affect good healthcare. We are still at the lower level where we still have to look at infant mortality and look at contagious diseases. The developed world has to look at more of the stress, depression, strain, the effect of man-made threats to modern living.